distinguished panel of pediatric specialists and neonatologists was convened by Dr. Xu Li, Professor Emeritus at the University of Toronto, to review the medical evidence used to convict Lucy Letby. She's serving 15 life sentences for murdering 7 babies and attempting to murder 7 others. The panel members, who rank among the most senior experts in the world, include Nina Modai, a professor of neonatal medicine at Imperial College London, Mikhail Norman, a senior physician at the Karolinska Institute and founder of the International Society of Evidence-Based Neonatology, Andon Stark, professor in residence of pediatrics at Harvard Medical School. Case notes for each baby were examined by 2 experts independently, who then passed their reports to the chair. If their opinions differed, a 3rd member of the panel reviewed the case, and a consensus view was reached. The panel worked under the agreement that their findings would be released whether they favored Letby or not. Baby 1. The baby boy was alleged to have died after air was injected through a catheter into a vein, causing an air embolism, an air bubble that blocks a blood vessel, which in turn led to collapse, discoloration of the skin and death. The expert panel found no evidence of air embolism and attributed the baby's death to thrombosis. Baby 4. The baby girl was alleged to have died from the same cause as baby 1, namely an injection of air into an intravenous line, leading to an air embolism that resulted in collapse, patchy discoloration of the skin and death. The panel concluded that baby 4 had died from systemic sepsis, pneumonia, and disseminated intravascular coagulation, where blood clots form throughout the circulatory system. The mother should have received antibiotics in pregnancy, the panel said. When the child was born, there was a delay in recognizing that she was in respiratory distress, and in starting antibiotics and further treatment, there was no evidence of air embolism. Baby 6. The court heard that baby 6 had died after being given synthetic insulin through an infusion bag. The experts found that the boy had prolonged hypoglycemia, or low blood sugar, because of sepsis, premature birth and borderline poor growth in the womb. He received poor medical care for hypoglycemia. Baby 7. The baby girl was alleged to have died after being deliberately overfed and having air injected into her stomach through a nasogastric tube, causing vomiting and clinical deterioration. On reviewing her medical notes, the panel concluded that her vomiting was due to an infection, possibly enterovirus. They found no evidence to suggest air was injected into the stomach or that the child was overfed. The panel found that baby 9 had died from respiratory complications caused by respiratory distress syndrome and chronic lung disease, complicated by infection with Stenotrophomonas multifilia, a multi-drug-resistant bacterium. Doctors caring for her failed to respond to surveillance warnings about the infection, did not recognize the diagnosis, and did not treat her with appropriate antibiotics. The experts found no evidence of air embolism or of air causing diaphragmatic splinting. Further evidence suggested the apnea alarm may not have been switched off. This was likely a preventable death, the report notes. Baby 11. The court heard that the baby girl had first deteriorated after an endotracheal tube, a flexible plastic tube inserted into the windpipe, was deliberately dislodged. The consultant alleged that the alarms on the baby's incubator were deliberately turned off to prevent a prompt rescue because he did not hear the alarms when he entered the room. The panel found no evidence that the endotracheal tube had been dislodged. The reason the girl's condition deteriorated was that the tube used was too small. The initial placing of the tube was traumatic and poorly supervised, the report claims. It adds that the consultant did not understand the basics of resuscitation, air leaks, mechanical ventilation, and how equipment commonly used on the unit worked. There was also evidence that the incubator alarms were not turned off. Baby 15. The court initially heard that the boy, a triplet, had suffered blunt trauma to the abdomen, causing purpling of the skin and bleeding on the liver. Air was allegedly injected into the nasogastric tube, causing the intestines to swell. Later, the accusation was changed to deliberate injection of air into the boy's bloodstream. The expert panel said the boy had died from a subcapsular liver hematoma, or bleeding beneath the outer layer of the liver, caused by traumatic delivery. This resulted in hemorrhage into the surrounding abdomen and profound shock. This was not recognized before the child died. In summarizing their findings, the panel flagged more than a dozen problems that were likely to have contributed to the baby's deaths. These ranged from failures in diagnosing disease, poor skills in basic medical procedures, such as inserting chest tubes, poor management of common neonatal conditions, like low blood sugar, and a disregard for warnings about infections. There was no medical evidence to support malfeasance causing death or injury. In any of the 17 cases in the trial, the report concludes death or injury of affected infants were due to natural causes or errors in medical care.